may be curious about the answer to this, so have a listen. Question is it a serious concern if I'm bleeding in between my periods around the time of ovulation? So, quick answer, probably not a serious concern. It can be common. But longer answer is that if it's heavy, if it's crampy, if it happens every time, if there are other symptoms associated with it, then you definitely need to see your doctor. One of the main things I'm concerned with or could be concerned with would be ectopic pregnancy because I think people don't realize you can have a period and still be pregnant because with ectopic pregnancy, it occurs outside of the uterus, usually in the tube or the ends of the tube, and the uterine lining can continue to bleed on occasion, not usually regular pattern, but it can definitely bleed. And so I would be concerned and want to make sure that this person wasn't pregnant. But if it's a very light amount of spotting around the time of ovulation, that can be normal. It can also be normal to bleed or have light spotting after intercourse. We call that postcoital spotting. But if there is spotting or bleeding that doesn't seem to be in phase, you want to make sure there are no big concerns. What are those big concerns? Infection, sexually transmitted infection could result in spotting or light bleeding outside of phase. Ectopic pregnancy, we just talked about, and also things like endometrial hyperplasia or precancer in the lining of the uterus that can cause bleeding or spotting out of phase as well. So, probably not a concern, but definitely worth having evaluated if it's something that continues, something that gets heavy, something that you can explain. And don't forget to like, follow, and subscribe.